Good morning, everyone. My apologies for my technical glitch, and I'm just going to move through these slides, and we will show you our not February 16th, March 16th agenda. So we'll do our usual. We'll introduce everyone. We'll have a couple of announcements. We'll talk a little bit about some updates on the medical home portal. And then you'll have some time to share with us any cases that you're working on that you'd like some help with, or you want to update us on any resources that you've come across. We'd love to hear about those. Really, anything at all that you'd like to share, it's your time, and we encourage you to take advantage of that. And then we're really looking forward to having an update today from Gina Pola-Money and Janet Wade, who are with the Legislative Coalition for People with Disabilities. And they'll let us know what's happened this year on the Hill and how that might affect us and the people that we work with. And finally, we'll wrap it up and be done by 10 o'clock. So let's start now with the introductions. I'm Mindy Tueller, and I am the Director of Operations for the Medical Home Portal, and I facilitate this meeting and this group. And I'm just delighted to see everyone here. Michelle, would you like to introduce yourself?
Yes, hi, I'm Michelle Redfield. I'm the Administrative Assistant for the Medical Home Portal, UCCCN, and I work closely with Mindy.
Thanks, Michelle. And I'm just going to go through the participant list that I see via Zoom. So that's largely alphabetical. So if you're able to unmute and introduce yourself, that's terrific. Of course, we also love to see your face if that's possible. If you're not able to do that, please feel free to use the chat if that's an option for you as well, and we'll read that out for you. So next on my list, I see Amalia.
I work at UDAC at the University of Utah, and I work with the UPIC team with Gabby and Heidi. I'm a project coordinator, and I work primarily with the Spark for research for autism and the Aspire project.
Thanks, Amalia. And next is Tony.
Hi, my name is Tony Estrada. I am with the Integrated Services Program. I'm a care coordinator and mainly work in the northern part of the state.
Thanks, Tony. Glad you're here. Next, I see Cassie Crane. Maybe we got a chat. Cassie says, good morning. She's Cassie with the Wasatch Pediatrics South Point. She's care coordinator. Glad you're with us, Cassie. All right, Dora. I see Dora.
Can you hear me?
Yes.
Yes?
Yes.
Okay, sorry, I'm multitasking. I'm in my car. My name's Dora. I'm from Shriners Children's in Salt Lake City, and I primarily just travel and let the providers and anyone in the community know of the resources that are available for children at Shriners Children's. Thanks, Mindy.
Excellent. Well, stay safe and great picture. All right, Eric Christensen.
Hi, I'm Eric Christensen. Much less good looking picture than Dora, but I'm the program manager with the Utah Department of Health Integrated Services Program. We're part of the Bureau of Children with Special Healthcare Needs.
Glad you're with us this morning, Eric. And thank you, Angie Richens, for putting your information in the chat. I'll go ahead and read that now. Angie is the Director of Behavioral Health and Case Management with Alpine Pediatrics. Glad you're joining us. Okay, Erica Wall.
Sorry, I had to find my buttons. I'm Erica Wall. I'm a registered nurse for Tri-County Health. I cover Duchesne, Daggett, and Uinta counties. I'm part of Eric Christensen's group, Integrated Services.
We're very glad you're with us, Erica. Thank you. All right, Gabby.
Good morning. My name is Gabby Baragoshi. I'm one of the QI coaches at UPIC and working with Amalia and Heidi. Thanks for having me.
Of course. We love having you, Gabby. All right, Gina Pola-Money.
Hi, it's good to see so many of you again. So I am Gina Pola-Money. I was originally with UPIC, UCCCN, and medical home, and now am retired and loving being a grandma, and decided I couldn't stay away, so am volunteering for the Legislative Coalition for People with Disabilities. Thank you.
It's great to see you. And of course, you couldn't keep yourself from being involved. Of course. All right, Gwen.
Hi, I am part of integrated services team with Eric and Erica and Tony and Walt and our Natalie's and everybody. I cover Carbon, Emory, and Grand County, and I really like being invited to this group. Thank you.
Gwen, we're so glad you're with us. That's Gwen Anderson. And Heather Carlson. Looks like she might be using the chat. Heather says she's a nurse care coordinator with Integrated Services with Eric Christensen's group. We're just delighted to have you with us, Heather. And we just love all of the folks who work with Eric. You guys are terrific.
And for some reason, that mic does not work with Zoom on Heather's computer. So anyway.
Well, Heather, chat away if you need to, be involved. Heidi Bates.
Hi, I am Heidi Bates. I work with Gabby and Amalia with UPIC.
Heidi, we're glad you're with us this morning. And Ileana.
Good morning. This is Ileana and Janet from Southwest Children's Clinic, and Janet is our care coordinator.
We're glad you guys can join us today. That's terrific. And we have another Janet, Janet Wade. Can you introduce yourself?
Yeah, it's again, like Gina, it's nice to see everybody again. And previously I was with Easter Seals Goodwill, and now I'm retired and secretary for the Legislative Coalition for People with Disabilities.
So Janet and Gina will be presenting to us in just a little bit, and we're so glad you're here. Thank you, Janet. It's great to see you. Okay, Ivana. Ivana may have put something in the chat. Good morning, Ivana Di Santiago, Nurse Care Manager with University of Utah Health Plans, working with the Healthy U Medicaid population. We're so glad to have you with us, Ivana, and we appreciate your perspective, so please don't hesitate to chime in. And Jennifer Goldman-Luthi.
Good morning. I'm Jennifer Goldman-Luthi. I'm a pediatrician at the University Pediatric Clinic, and also work on the medical home portal and the pediatrics echo. And it's lovely to see all of those of you who I know and those of you I don't. It's fun too.
Wonderful. Glad you're with us. And Jill Connor.
Good morning, Jill Connor, Director of Business Development at Shriners Children's in Salt Lake City. I work with Dora. We do everything involved with our physician outreach, community outreach, and patient acquisition efforts.
Jill, thank you. We're glad you're with us this morning. We love you guys from Shriners.
Thank you.
All right. And I see another Jill Farron. Not sure if Jill's able to unmute or maybe use the chat. That's okay. We can come back to Jill. And let's go to Jennifer Huntington.
Hello. Hi.
Hi. Jennifer, can you tell us who you're with?
Oh, wait, I can't hear. What is she saying?
That's okay. Looks like Jennifer's multitasking too. We're glad you're with us.
Jennifer's from the University Pediatric Clinic. She's one of our care coordinators.
Oh, excellent. So glad you're with us. All right. I see Katie Krumholz.
Hi, yeah, so I am Katie. I'm with Help Me Grow Utah. I'm a parent support specialist, so we work with sending resources to parents.
That's fantastic. We're glad you're with us, Katie. Natalie Allen.
Hi, I'm Natalie Allen. I'm nurse practitioner with Integrated Services Program.
Hi, Natalie. All right, another Natalie Carter. We might have a chat. Natalie is the CSHCN coordinator for Central Utah, also with Eric's group. Very well represented today. Wonderful. Thanks, Natalie. All right, Rebecca Ciolino.
Hi, I'm Rebecca. I'm a nurse care manager at the University of Utah.
Glad you're with us.
Thank you.
Tina.
Hi, I'm Tina Purcells. I am the parent of a 22-year-old young man with multiple disabilities and who's at school right now. And I'm also with the Utah Parents Center. I'm with UCCCN Planning and the Medical Home Portal, and I'm glad to be here.
We're glad you're here too, Tina. Welcome. All right, Walt.
Good morning. I'm Walt with Integrated Services Program, also with Eric's group, and I'm a care coordinator in the Salt Lake City office. Glad
you're with us, Walt. And finally, I have Yvette, who has put in the chat. She's a patient care coordinator with the U of U Pediatrics Clinic. We're glad you're with us, Yvette. All right. Well, I think that's everybody. Michelle, did I get everyone?
Yep, it looks like it.
Okay. And please feel free to put in the chat if we missed you, if you're joining late, that would be great. So the reason that we take the time to actually do all of the introductions, sorry, it looks like I went a little bit ahead on my, there we go, on my slides. We take some time to do the introductions because we really feel so strongly that a portion of the UCCCN experience is networking. It's getting to know those of you doing similar kinds of things. And if you're interested in connecting, we can make that happen as well. So that's why we dedicate this part of the meeting to actually hearing your voices, seeing your faces, if that's possible, and finding out what it is what you do. So terrific. All right, and thanks, Jill. Jill was able to put in the chat. She's Jill Farron, care coordinator with Wasatch Pediatrics Grow Up Great in Bountiful. Glad you're with us. Okay. So a little housekeeping, we do these on Zoom, and the way to get the full experience with Zoom is really via more of a computer laptop kind of experience versus a phone. But whatever way you can join us is great, and we will try and end promptly at 10. Go to my next slide. There we go. So some announcements. Just want to make sure that unlike me, you're aware of the new Zoom registration meeting link. So that was my problem this morning, too many Zooms. And the way that happens is you've got to register for one or multiple UCCCN meetings, and then you can put that on your calendar. And that just makes the process a lot smoother, typically. So hopefully you've all figured that out because you've joined us and it seems like it's working. And we're also trying to be more proactive with what we're letting you know we're doing. And it looks like that slide, there's that slide. So we've got our legislative session update this month, and I think that's going to be something we try and do annually, and it's been great to have these updates in the past as well. So that's why we're doing this one. And next month, we're excited to have some URLand folks, the Utah Regional, Gina, want to help me real quick with the acronym?
Utah Regional Leadership, Education, and Neurodevelopmental Disabilities.
Excellent, thank you. It's a wonderful program that Gina was a part of for many years as well. And we're looking forward to having a really terrific group of trainees let us know what they've learned this session about enhancing referrals for children with complex and chronic conditions and how to improve that process. So that'll be next month. And then you can see we've got a number of other things on the docket as well. I'm going to go back one slide and talk for just a minute about something that we've been thinking about in our planning. And Eric, I don't know if you'd like to talk about this, but not trying to put you on the spot, but I do want to give you the opportunity if you're interested in bringing this up.
Well, sure. We've Let me give you just a little bit of background here. In the state, we receive, it's called Title V money. It comes in from Maternal Child Health Bureau federally. And that money, as it comes into the state, 30% of that is used for supporting children and youth with special healthcare needs. And we have two initiatives as part of that block grant. So the first one is promoting a medical home. The second one is ensuring that youth who are of transition age are receiving all of the supports and services necessary to ensure that they have a smooth transition into adult medicine. Looking at that first one, the medical home and supporting the medical home, that's where this group really comes into play. Our Children's Care Coordination Network is a powerful group full of really amazing people who connect our families with support services and specialists across the state. And that ability to connect families is really at the heart of what constitutes a medical home. And so we are looking at what would be a way to recognize practices who are doing a good job implementing components of either or both a medical home and transition to adulthood services. So we want to kind of throw out at you generically as care coordinators, practice managers, maybe folks who would be in a management role who would be able to promote some sort of recognition. What would be something that would be valuable to you as a practice to show, demonstrate to your families, demonstrate to other professionals that you are achieving some sort of success in promoting the medical home concept and also helping your youth transition successfully to adult medicine? Was that enough or too much? I hope, talking off the cuff, sometimes I ramble, so I hope I gave you enough there, folks.
And I think, Eric, we had talked a little bit in our planning meetings about whether something like a certificate would be of interest, something that maybe could be, I don't know, framed in your office, and also maybe some sort of a digital version of that could be on your website, something like that. We're early days in this, but we wanted to know if that would be something that practices might find useful, helpful in that acknowledgement. And you don't have to answer right now. We're not doing a poll on this per se, but if you wanted to put something in the chat, you'd be welcome to. Just so you know, the chat feature allows you to do a chat to everyone or to someone individually. So you could always do that directly to Eric or directly to me if you're interested, or you can follow up later and we'll follow up with you. So we just wanted to put that
and just so you know, along those lines, and thanks for that reminder, Minnie, what we'd be looking at is, something that would kind of say, would have, for lack of better term, just like the Good Housekeeping seal of approval or something like that. It would have Utah Department of Health and maybe, University and IHC and Utah Parent Center, or, some organizations that really promote the medical home and show that you've demonstrated some sort of, promotion. We're not saying achieving the pinnacle of medical homeness. We're saying you've crossed every wow, let's look for a different metaphor there. Dotted every I, crossed every T as it relates to that transition to adult medicine, but saying that you are achieving some success there and that you promote those. And would that give your practice the perception of enhanced value and collaboration that would show some real value to your patients and the families that you serve?
Great. Okay, we'll leave that nugget with you.
I'll just add my 2 cents really quick. I think it would be great to, I was just in a different state meeting with childcare where they're giving people inclusion badges. And I think that's wonderful, but I think we need to make sure we have a checkoff list of, are they really doing these things? And I think an award of excellence for like inclusion and transition would be something that I would hope that people would value, or clinics would value. And maybe, we create like, are they doing this, and this? And then also I would go as far to say, why don't we look at the adult clinics as well and see if we need to give any of them awards, because that's really where we're landing too. So
That's really interesting. Thanks, Tina.
mhm.
Really interesting.
That's why we love Tina and her incredible perspective, and all of you who might have some sort of take this a little bit further and think this over, but reach out to us if you can think of other ways that would really be good, good way to show recognition, or what some of those, going along with what Tina said, some of those other things that might be a kind of a check off to say this is quality, or this is a quality standard that we might want to consider. I also want to throw out to you as well, we have 2 monthly committees that meet, the Medical Home Committee and the Transition to Adult Medicine groups that meet monthly with Utah Department of Health. And each of those meet for 1 hour a month. And we would invite anyone from the practices or anyone in this group who would like to participate on either of those committees to help shape policy and direction of where these initiatives are going in the state. We'd love to have you as part of those work groups. So if you are interested in that, please reach out to me. I'll put my contact information in the chat, but we would welcome anyone from a practice perspective, or anyone who, service provider perspective, anyone in this group who participates and feels like they could give perspective and direction to these 2 very important initiatives. We would be delighted to have you work with us.
Definitely. Great. Thank you, Eric. All right. Let's get back in a few more announcements, and then we'll get into the brainstorming. So just a reminder about Pediatric Project ECHO, which now is part of kind of Dr. Jennifer Goldman-Luthi and my and Michelle's purview. And so we're in our spring session. Our next regular session presentation is on the 30th, and it's around sleep issues. And I think that should be really interesting. And then we're also doing a parallel autism ECHO module, and it happens on the 4th Wednesday. So we had one in February around early signs of autism. It was very well done, very interesting. And our next one is next week on surveillance and screening. And so we invite you to register for any of these, and we'll make sure that the link to doing that goes out with the meeting summary. Quick updates. We've got some content that's been updated on the medical home portal in terms of our Down syndrome module and our foster care module, and also our toxic stress screening page has gotten an update. And then we've been doing a lot of work on our newborn disorders, and those include all of these and more. So we've got quite a few of them. I won't take the time to read those, but know that they're all going through and being updated. And so what that means is we're making sure that all of the information is as up to date with regard to guidance as is possible. All right, so we try and spotlight something on the medical home portal every meeting. And so I just wanted to remind you that we do have a lot of advocacy information and resources on the medical home portal. I'm going to show you the website for just a moment, but I know we're running a little bit late, so I won't take long. So just to remind you that probably one of the best ways to find information on the medical home portal is to use the search bar that's on the top of every page. And you can see that we're going to have a bunch of results here. One of the ways that you can sort of filter these results is if you're interested in finding organizations that provide some kind of a service around advocacy, you can choose this option here, and that will whittle down what you're going to be able to see there. if you want to see everything that we've got, you can choose the all, or you can choose any one of these other filter buttons. And I just wanted to click on this particular page, Advocacy, Finding Your Voice, because this one is kind of talking about advocacy in terms of the levels that you can look at. So advocating for the child, and then also for individuals, but even more looking at advocating for the community, and even going to the point of the legislature and trying to do things at that point. So we just wanted to let you know that there is quite a bit of information on advocacy on the medical home portal. And we hope you'll keep that in mind as you're listening to our presentation today. All right, I'm going to get back over to my slides. Okay, this is your time. So we hope that you'll take a few minutes if you're interested, and let us know about any cases that you are having some trouble with. And okay, Ivana, yep, I understand, no problem. Thanks. We'd love to have anyone unmute and speak up or put any information in the chat. This is, again, an opportunity to connect with people in this group and to share ideas and ask for help and so on and so forth. So I'm going to be quiet. Okay, wow, usually the uncomfortable silence prompts somebody to say something. So if there's really no cases or nobody wants to say anything, that's okay. That's just fine. But I want to remind you that we have a listserv that is available anytime. And it's always so interesting when somebody uses that to see what a groundswell we get from all the people on this on the list and in this group to help when there are needs of resources, help with a case, all of that kind of stuff. Tina.
Since we don't have a lot, I'll go ahead and share a resource if everybody wants to see something very cool, really quick.
Yeah, do you want to share?
Yeah. So Utah Family Voices has been working on a mini grant to allow, can you see the My COVID risk? Is that what you're seeing? Okay. To, keep that outreach going, keep that awareness going, talk to people with disabilities and support them on getting vaccinated, staying safe, all those things, because, it's not time to shut down on all of that yet. So we've been doing this for a bit, and I found the coolest resource. I worked with some youth last week and showed them this. It's called My COVID Risk. It was developed by Brown Medical School. And I think what we've seen is youth and young adults who are really scared, youth and young adults who don't know how to find, what their risk really is in their area. And for that, also us adults sometimes. And so we're going to run through this really fast, and then you'll see how cool it is. So this is called My COVID Risk. It's an app that was developed to know your risk. So I'm going to just go through it. I'm Tina. I'm older than 13 for sure. I have no COVID symptoms today. Can you see me doing this? Okay. I understand that this calculator is an estimate and doesn't replace a doctor's or medical advice. And I'm in the United States. I'm not leaving today. So what am I going to do today? I think maybe like Mindy and Gina and I and everybody here will go out to lunch somewhere. And so we're going to say, let's say we're going to go downtown to lunch. We'll put a downtown area code in there. And we're going to search. So we're in Salt Lake City. Next. We're going to go to an indoor restaurant. We are eating at a restaurant. How long do you guys want to be there? Like, let's see, we want to go at least for an hour for sure. You can make that more if you want. How many people are going to be there? Let's say, we don't know, it's a restaurant, right? So let's say, gosh, maybe 50 people in the restaurant. And then what percentage of people will be wearing masks? Well, I've been out lately, and I don't know about you, but I'm not seeing a lot of masks out there. So I'm really going to say, let's try 0% and let's just see what happens there. What is my risk? Kind of high risk right now, right? That looks a little, that would make me nervous. Like, what do I need to do? Should I go out today or what? But this is a real calculator. It kind of gives, you know, what's really happening in your area. So I like that. But then down here, if you see, and this, I saw a couple of the kids I was working with have a little relief after we did this part. So how do we lower our risk? Well, let's see. I know I've had Pfizer and I've had 3 doses so far. I say so far because the news this morning says we might need another one. I have an N95 mask, so I could wear that when I'm not eating, right? Social distancing in a restaurant is kind of hard, but I think I'm going to try 3 feet just to try it. And are there people at your activity that are fully vaccinated? Well, yes and no, but I don't really know. I know everyone around me probably is going to be, so I'm going to say yeah. And then we'll say what percentage? Well, maybe 50%. Let's say 50. Oh, look at those big needles. That's crazy. Okay, and then I'm not going to reduce my time because I need a lot of time to eat lunch. And yep, I sure can wash my hands frequently. I'm not wearing one of those things on my face. If you guys want to, you can when we go to lunch, okay? Or no eye protection. And then ventilation. I think it's going to be closed because it's rainy and cold outside today. So what's my risk now? So doesn't that ever give everybody a little bit of a, okay. Well, if I put a few things in place, I have quite a bit of a lower risk. Just wanted to show you that cool thing. If it helps anybody out to use it, it is just called mycovidrisk.app. And it's kind of fun. And I think I'll be using it just to kind of see where, I don't know.
That's helpful. Thank you. Thank you, Tina. We'll make sure that that link gets sent out with the meeting resources. Okay. Wonderful, wonderful. All right. Okay, well, I'm not going to go back to the slides unless you would like me to show the slides you sent me, Gina. Would you like to share or would you like me to pop yours up? Sorry, did I say that right? Would you like to share or would you like me to share?
How about if you do? I didn't think about saving it to my screen, so it'd probably take me a minute or two to bring that up. And there's only a few anyways.
I've got it. So let me get it in. And then I will share.
Thank you.
I think. Okay, now I don't know what I'm doing. Let me try it one more time.
If not, I can hurry and look for or get down.
Oh no, I've got it. I was just doing too many exciting PowerPoint features. So I'm going to reduce those down. Let's just get it on the screen. Let's see. Are you guys seeing it?
Yes.
Okay, great. So let me try this. You're probably seeing the wrong one, right?
That's with Yeah.
All right, very good. Okay, please go ahead.
Okay, and I'm going to turn it over to Janet.
Okay, so Legislative Coalition for People with Disabilities was started way back in the 80s. Jan Ferre, who's still with us, and our leadership team, Chris Forson and Joyce Delcott, started LCPD and has made a huge difference for children and families and adults with disabilities ever since. We're really a grassroots organization. There are several organizations out there, Disability Law Center, the Parent Center, a lot of other organizations, but our goal and our demand that was sent out by the legislature back in the 80s was that they wanted one place that they could go to find out about issues. And that place became the LCPD. We're made up of parents and self-advocates and other agencies and other providers as well. And we meet monthly. And in the session, we meet weekly. And we provide information. Legislators actually call us to ask our opinion on things. And there was an instance this session where a legislature put through a bill that came up, an issue that came up from a constituents, just one constituent brought this issue up. And they got hold of LCPD, and we got hold of Andy Curry, who was in a wheelchair, who understood the issue about parking. And what the legislator was doing was actually against the ADA, his original bill. And through talking to LCPD, he changed his bill and got that passed, and it wasn't against anything. So we get lots of calls. And the biggest thing that LCPD does is build relationships. And that is the most important thing in advocacy. Next slide, Gina, I think.
Mindy, next slide.
I'll just say that jumping off from what Mindy was saying about the website, I know it's hard when you work for a state agency. I've worked for the health department. You have to be very careful, but you can provide families and self-advocates information. And it's really important that families and self-advocates know that they can get involved and they can make a difference. And in fact, it's the only thing that makes a difference is self-advocates and families with family members with a disability. And that was really evident this year in the legislature. There was a very concerted effort to close the wage gap for direct support professionals. Must have been, I was in the session, about 25 families who came to speak to the Social Services Appropriations Committee about the problem of finding providers because of the low wages. And that proved a lot of the legislators on the Social Services Appropriations Committee were new. And if you are not in the disability field or you don't have a family member, you have no idea about this stuff. I mean, there were like 6 legislators, I think, that were new who didn't know there was a waiting list. And they were shocked. And they were banging their fists on the table and saying, you know, this has to stop. And there were more new members this year than I've seen in previous years. So it really is important to get a voice out. Not just from agencies, but really important from the people who are living and breathing the issues. And the testimony, it's scary, but everybody's really nice. And the testimony was amazing from all the parents and self-advocates who spoke. So to find out about Legislative Coalition, we have a website that is in the process of being updated. Thank you, Gina. It's not very good right now. But once that's updated, you can go on there, and I will put my email in the chat. So if you want to be added to the mailing list, I will add you to, I hold the mailing list. I will add you to that. And when the website is up to date, then you can go on and join the coalition. It's free, there's no cost. We rely solely on donations. We're not paid for what we do. And yeah, as soon as that website's up, you can get on and become a member, and that means you can vote. So agencies are not allowed to vote, but family members, providers are allowed to vote. Okay, next slide. So this is self-explanatory. Even though you're just going to be getting an update yearly, I want to advise you, especially this year, to keep just maybe have a little update on the interim sessions, because especially Health and Human Services, it's really easy to find what's going on. You just click on le.utah.gov and then calendar, and then you can click on the interim, just search, and it will show interim sessions, and it'll show Health and Human Services. So, and there'll be an agenda. So you can just quickly go on there, look at it, see if there's anything that impacts you. And if there is, then you might want to, let some parents know that it's important that they hear your voice. The other important thing for parents, and it's a really easy thing to do, is just to get to know your own legislator and form a relationship. Now is a great time when legislators are collecting signatures and running for office. If you can go and help them, make sure, sign the paper, offer to help, knock on doors or whatever, it's the best time to form that relationship with your own legislator. And even though they might not be on the Social Services Committee, they have friends on there. And so they can support your voice on that committee. Okay, next slide. Okay, here we are. Here's a rogues gallery. So Everett Bacon is amazing. He's our chair. There's me getting my citizenship at last, hooray. and Gina is treasurer. And then Anita Bennett, Amanda Francis, and Jan Ferre is with us. Okay, I think that's it.
Oh, I forgot to put Jan on here, and I apologize. These are the leadership team members. I just wanted to say a little bit more about that. Now we'll just kind of go over what happened and may, impact those that you're helping, the families and the children, youth, and young adults with disabilities. Everett is, like she said, amazing. He is an individual who is blind, and I have learned so much from him. And a lot of what we do, as Janet said, is it's full-time during this session, and it is all volunteer work, which is amazing of what we get accomplished, because Everett works full-time for the state. Janet is supposed to be retired as well as me, but that doesn't happen very often. And then Amanda Francis is a parent, as well as she owns a home health care agency, which became because she's seen a need. She is like myself and Tina, that has a child that is vent dependent, and seen that it was hard getting nurses for this specific population. So she works full-time too. And then Anita is a mom that has a full-time job with her now adult daughter. So with saying this, I was a little worried going into this, because I thought, well, what are we going to know? Even though Janet's still heavily involved with infant mental health, I still am family faculty for UR-Land, which is our state plus 4 others. And Eric will be happy to hear this. I'm still a reviewer for Title V block grants. I'll never review Utah's because of course it's a conflict of interest, and then work with the National Family Voices to get what's coming down the pike to see if it can help in our states. And when families and agencies contact us, and Janet had a really good explanation. This year there was quite a few. We also have a yearly reception where we invite families, self-advocates, agencies, and then of course their legislators. We had the biggest turnout this year. It was mainly families, but we had more legislators come to us than we ever have. And it was amazing because we realized that there really is a need for the legislative coalition for people with disabilities. So I'm thrilled to be a part of this now. And so now I will let Janet start off the list of things that may impact the families and children you serve.
As Gina said, one of the things I just want to stress that we do, you might not see us being very visible. We do a lot of things behind the scenes. During our weekly meetings, we track bills and we track appropriations, and we vote to support, oppose, or follow. If those things we support, then we will write a letter to all the members of the committee from the Legislative Coalition. And I've heard legislators say at the reception, well, oh, the Legislative Coalition didn't approve this, so we needed to go back to the drawing board. So we've built up that reputation over the years of being friendly, relationship focused. We don't get angry with legislators. I mean, we would love to sometimes shake them, but we don't. You just have to be a friend. So, and as I said, the example of a really concerted effort by actually the Provider Association led by Charlie Luke, really worked hard on closing the wage gap from it's about $11.75 an hour for those direct support professionals. And they asked for 40 million. What they got was 24 million in ongoing and 5 million one time to increase starting direct care salaries to $16 an hour for both home and community-based services and intermediate care facilities. So that's huge. They added the 5 million now so that they could start building on that. So they could start hopefully being able to hire, because otherwise the system was going to fold. If they didn't get this wage increase, there would be no DSPD services, whether you were on the way, you know, under services or not. People just couldn't find providers. And the interesting thing about this, I don't know if you remember 2 years ago, Amendment G was on the ballot to use income tax funding or education funding for disabilities if needed. This is the one time is from the general education / general fund education fund. So this is an example of where they use some of that funding. Also using a mix of general and education fund was the waiting list. I think we asked for about I can't remember how much we asked for now, 16, but we got 6 million, which you go, oh, we didn't get enough. But last year we got nothing. The year before we got 1.5 million, and the year before that we got 1.5 million. So 6 million is huge. So we're very excited about that. So more people will be able to get under DSPD for services. We tend to kind of split ourselves up a little bit. One of the issues that I really focused on was caregiver compensation. I worked with Lisa Thornton, that some of you know, and Lisa did a gallant effort. She got lots of families right into the committees at the right time. This was in the governor's budget. It wasn't a bill, and it was a strange thing. It just went straight to executive appropriations, but they managed to get 5.1 million in one-time funding. So that funding last year during the pandemic, that was when this came about, the caregiver compensation, because of the pandemic. And so this year we've got it again. We will be working on moving that to ongoing funding because we believe there's a real need for that caregiver compensation. Gina, I'm going to let you just talk about the medically fragile complex waiver.
Okay, so the MCCW, or the Medically Complex Children's Waiver that was passed not too many years ago. As we all know, we tell families about it, but this is one that there's not a waiting list because they don't allow that. They just, when they have open enrollment, and that means because they have a few open spots, then they'll have people apply, and then they'll go through and look at, you know, their points based on their needs and such. And so it's been really frustrating for families, especially those with the younger kids, that they're just trying to figure out how to juggle it all with kiddos that have at least 3 systems involved and at least 3 specialists involved. So we have a champion, Steve Eliasson, and he's a champion for so many things, and especially this because he does have a child with a rare condition. And so, of course, he knows from a parent standpoint, and then he also knows, of course, the legislative process and all of that. So he went in with a bang in trying to extend that to 300 more slots, which would be amazing. The initial bill also allowed for behavior as one of those systems. Unfortunately, that got knocked out really fast. And so it ended up that they cut it drastically from what he was asking for. And Janet, you probably have the numbers, but what it ended up being is that it will allow for 130 more slots, which is still amazing because we know how many of the families like mine and others that really, really need it and cannot wait for those few slots to open up annually. The one thing I'm not sure of, and I will get more information because I realized I didn't see if this was changed, was it was supposed to go to where there was, you know, that we didn't have to wait annually till there was a slot open, that it would be a continuous enrollment, kind of like DSPD or the technology dependent waiver. So I will check on that. But at any rate, because of many families that, including myself, that wrote, testified, and then had that champion in our representative, it luckily did pass. It's hard that it didn't get as much money because of other things, but which we say, we don't try to be mean, because some of those that poo-pooed some of our stuff could be our champions for the next time. So we keep all relationships ongoing. And we just feel like for DSPD and the medically complex this year, that it was a win, because maybe we didn't get as much as what we wanted, but it definitely is more than we've got in many, many years.
And this is a case also where you might want to watch the interims for Health and Human Services, because that million is only if CMS approves it and if there's enough money. So it's not a done deal. So that's something we'll be tracking really closely to make sure that was happening. Then I looked through my list and thought of the work you do and parents who might need some resources. So Strengthening Families, Preventing Child Abuse, they got funding, 3.4 million from the general fund and the education fund, the crisis and respite nurseries, as well as training and education for families and staff to prevent child abuse. So that's, you know, a resource for your folks. Local health departments, you might be interested, compliance with state standards, they got 4 million ongoing. for increased funding for each of the state's 13 local health departments to comply with local health department minimum performance standards for public health. Transition Salt Lake Medical Clinic to private provider. So the Salt Lake, the free clinic, they're going to transition that to a private provider with funds from the general fund to transition the remaining state-run medical clinic effective July 1st, 2023. So it's not going away. They're just going to hopefully transition it to a private provider. Domestic violence and sexual assault prevention, 3.3 million one time from TANF and 2 million from the general fund. So that's good. Housing, unfortunately, did not get the amount that was asked for. They got 15 million in one-time funding for housing preservation. Homeless shelter funding got 10 million one time and 5 million ongoing. Let me see, is there anything else? I think you might be 3 million in ongoing funding for equal Medicaid reimbursement rate for autism. And also, I don't really know a lot about this, but you Medicaid folks, Medicaid consensus in FY22, 63.4 million ongoing and 20 million one time for 2023 to provide medical service to an estimated 479,100 clients in 2022, with an increase of 65,000 in 2023, of 419 clients in 2023. So I think that's crisis receiving centers. I don't think I said that. 1.8 million from general fund to support behavioral crisis receiving centers. So that is, I don't know if you probably, a lot of you may know about the crisis receiving centers. Yeah. But that, I think that's going to be ongoing. That's going to come up every year so that they can expand that, the number of receiving centers available. So 1.8 million ongoing and 533,000 in one time. So are there any questions? Anything that I missed that you are wondering about what happened? I may know and I may not know. There's a lot of bills that go through. And you can always go, the Disability Law Center has a really good bill tracking sheet. So if you go on there and look under public policy, you can see all the bills that came up and what happened to them, because a lot die, a lot get circled, a lot never make it to the governor's desk. So
as Janet said, oh, hold on, Tina, if that's okay. As Janet said, I have just a few more, and then I don't know if you want to ask a question now, Tina. I should ask you that.
Real quick, I was trying to write some stuff down. So in the beginning, you said 24 million ongoing. Where is that going?
That's the wages, to close the wage gap, to take it from $11.75 to $16 an hour.
Okay, and then so there's 24 million ongoing and then 5 million one time.
Yeah, yeah.
All right, and then
to start increasing those salaries. So yeah, because there's a huge need now. That's my understanding.
And then what about current slots on MCCW? How many do we have before we got this extra 130?
What is she asking for waiting list?
No, there isn't a waiting list for MCCW.
Oh, MCCW. Okay.
Yeah. I could be wrong. I'm going to say there's 300, but it might have got maybe, I don't know, Eric, do you know? I want to say that it might have increased to 450 before the pandemic.
I was frantically trying to pull that up when you asked me, Gina, so I did not quite get the waiver on Medicaid.
Yeah, no, that's okay. I just
give me a minute and I'll have that info. So yes, I'll throw it in the chat once I find it.
Okay.
And I can tell you the number of slots that we had previously.
Thank you. And if not, I can also get that after. When I get put on the spot, I get nervous and can't find even my first name. So let me just give you a few more things that may impact. First of all, Janet mentioned Disability Law Center. I want to mention the organizations that we collaborate with closely during the legislative session, because all of them have pieces for children, disability, and health policy. So Disability Law Center is very much a part of the Legislative Coalition, as well as Voices for Utah Children and the Utah Health Policy Project. So between the four organizations, we're kind of, like I said, kind of dividing and conquering and hoping to get as much done and get as many voices from the community as possible, because they know who we are. They don't want to keep listening to us all the time. They want to listen to those that are who are being affected. So the other things that you may be interested in is, especially for some of you that have kiddos that are in the juvenile justice system, and they had a significant win this session. And there was 2 bills that were passed early on and focused on the services with Division of Juvenile Justice. The division now has rulemaking authority to assist young adult offenders whose custody had previously been terminated at age 21, because that's usually when they age out, especially with Medicaid, to continue participating in education, rehabilitative, and support programs until the age of 25. So that is huge. Another win is that a minor can be housed in a detention facility until 25, because this will provide access to adolescent treatment and programs that they won't have access to if they were under the adult correction system. So that's huge. There is also, you may have seen it on TV, the Period Project, where schools now will carry those needs. And we know that there are so many that don't have access to period necessities and such. So what didn't unfortunately make the line was, and it had strong bipartisan support, was the 100% kids coverage bill. This bill would have ensured that all Utah children could access health coverage regardless of their immigration status or where they live in the state. And it would have also restored the funding for continuous eligibility for children enrolled in Medicaid. And it would have extended postpartum Medicaid health coverage, which that was not even heard, unfortunately. And we know how important that is for new moms and, of course, their babies. So special education did get an increase. There is a lot of controversy with lots of things going on in education. The funding request for the optional full day kindergarten was slashed quite a bit. It's still there, but it is, of course, optional. And I think it will gain more momentum in future years. The other thing that is new is there is now a disability ombudsman through the Division of Services for People with Disabilities, so that there is an advocate there. I will say, we were hoping that it would be placed in the governor's office, because then we knew that they would have a little bit more pull than being in DSPD, but we are happy that that passed regardless. And then school nursing, we didn't get the win we wanted, but at least many of these new legislators are just flabbergasted about the needs, such as the waiting list, and especially our horrible percentage of school nurses in the districts. And so ongoing, and it's going to take a little while because they did not appropriate funding. They want the school districts to fund this, but they will require 1 school nurse per 2,000 students in the larger districts, and a ratio to be set by the Department of Health and Human Services in those smaller districts by 2026. This is something that we will continue to work on, because we know that school nurses are needed desperately. And then the school epilepsy education program. It's been there, but it's kind of been a hit and miss. And so this requires the State Board of Education to adopt guidelines for training school staff on how to recognize seizures and intervene every 2 years. Unfortunately, it's not annually, but at least it's every 2 years. And then a bigger thing that is not just Utah, but Tina actually is the one that alerted me to this. And then I got an email from other states. There are, and Adam hopefully will be a part of this, I'm not gonna be able to say it, compensatory, go ahead and say it, Tina. Anyways.
Compensatory services for COVID-19.
Yes.
Stuff that you
So these are that to help students make up for progress or skills that they may have lost during, with special education during our pandemic. So of course, it's not an automatic and it's individualized still, but that is good to know for any of your families that are really struggling, because we know so many of our kids just did not do well due to being home and not getting the supports and services that they needed. And then on the horizon, that is another Medicaid, but this is across the country. We are going to see millions that will lose coverage because when that pandemic health emergency ends, which is coming, they're saying that according to CMS, that nearly 1 in 4 across the United States signed up for Medicaid because of the need. And it's hard because we know with the inflation, we know because of all the things that people can't afford, this is one more thing that that will affect those that are very underserved or not served at all by losing their Medicaid. And we don't know when that's coming, but we do know it's coming fairly soon. So those are the big things that I think that affect your practices and your families. And if you have any questions, let us know. And
Gina, I missed off $1 million in ongoing appropriations for adult autism treatment. And also affordable housing. We did get 55 million one time from federal funds from the American Rescue Plan for deeply affordable housing. Again, not as much as was asked for, but it's a start.
So, and if you can all see that Eric did put in that there's 550 waivers, the slots, because I was one of the key constituents that helped pass that years ago. And we started out, it was amazing. We started out at 200 slots and then it got up to 300. And luckily, because of the efficiency of not only families, utilizing what they needed, but their private and health insurance helped offset the cost. So they were able to increase those slots as the years have gone by. So that's been good. And again, 130 additional slots is going to be amazing. One more thing that we will be working on, Janet mentioned the caregiver compensation. That is a lot kind of surrounded just for those that are on the DSPD community supports waiver. My fire behind me is that we keep forgetting that there is a lot of medically complex children and families out there. And so working with 3 other states and getting the language to see if we can either amend a current bill for caregiver compensation to include families, at least of adults with complex needs, so that they can get paid to be the caregiver. Because even with the increased wages across the board for direct support professionals, it still is not meeting the need of the lack of nursing, CNA, and all of that families are just going without and having to stay home. So I think caregiver compensation for medically complex children as well, it needs to be highlighted ongoing. So there you got my soapbox.
Oh, that's fantastic. I took a lot of notes. I'll probably come back to Janet and Gina to make sure we got some of those correct, and then be able to include those in our summary for you guys to refer to. I just want to take a second and just you don't have to raise your hand or anything like that, but I would be curious to know, and I won't get this information, but I'll let you know, I am curious if folks on this call and in this group have ever contacted their legislator. It's something that I think seems a little daunting. You hear the call for it, you might be listening to a program or reading something and know that you could do that, but it seems hard and you're busy, and I get all that, but it actually, with our digital age, it's become easier and easier. Thank you, Janet, to be able to get involved in some of these things. And the pandemic has that silver lining in that so many more things are shifting to virtual platforms. So I'll just share a little story. There was a bill, not right at the beginning, I can't remember exactly when it was, but it was about voting rights. And I was extremely concerned when I caught wind of it, and I got an email from a nonprofit that I belong to, and I'm on their mailing list, and it suggested a couple of things that you could do. And so I actually attended a virtual hearing, and they had such a turnout from normal people just like me that overwhelmingly it got shut down and was hardly even heard. There were a couple of steps for this bill that really would have limited how people could vote, including you wouldn't be able to go to a ballot box and drop things off any longer. You wouldn't be able to vote by mail. There were things that would have definitely affected the population that we serve. And they were going to only let people have, I think, 30 seconds if they attended in person to speak, and only 3 people on either side. Same for those virtually. So you can see that it can be really hard to even get your voice heard, but the sheer number of people who showed up in person and online, they could tell that there was serious opposition to this, and it worked. So I guess my point is that even though sometimes the barriers that seem to get put up can be really daunting, if we get involved, and it doesn't take that much, like I was just sitting at my computer anyway, I shifted what I was doing for a little while and did that, and then I came back. I think I made a difference. And so I'll just throw that out there to you. It can seem really daunting, but I send emails to my legislators fairly frequently, and they almost always get right back to me, and they're very appreciative to hear from me. I think people don't do it, and therefore your voice carries more weight. And if everybody did it, that would be great. Let's have that problem, shall we? But I guess I just wanted to let you know that this, you really can make a difference. If there is something that is important to you, it's easier than ever to get involved, and you don't have to feel like it takes over your life. So.
Thanks, Mindy. Actually, Everett would be really mad at us that we didn't bring that one up, because it really impacted those that are blind, because it would made it so that it was almost impossible for some individuals to vote. So yes, and the other one that got shot down, thanks to many, which was hard, it was called the Hope Scholarship, and that would be taking public funds to support private school. And so it would have taken away from special education. It would have been taken away from education period for our public school system. So we're really glad that that one got shot down. Not that, I mean, I think that there are some, issues on the other side, that because we can always see both sides, but this one really did need to be shut down. And as Mindy said, for all of you, if you haven't contacted, I just want to say it's really easy. I've been having to do and gather policies from 5 states. And so going through their legislative websites, Utah has one of the fast legislative websites if you want to be involved from a distance or, in person, of course, but you can sign up. You can find out who your reps and senators are by putting in your address. And they've just made it really, really easy. Thanks, Mindy. It's under that My Legislators. And then as Jenna mentioned before, the calendar's there so you can see what's coming up even after the legislative session ends. And then I'll put in a plug for the Legislative Coalition is to email Janet with your email address. Because even if you don't want to and don't have time to be a part of the monthly meetings or the weekly meetings during the session, Janet does such a great job in the minutes that most of our agency reps and such wait for her minutes because they can really see what's going on so that they're still included even if they cannot be in person. And then if something actually, hits a chord with you, then you know what's going on and we can help you get the information if you want to, as always, as a private citizen, to make a difference.
Yeah, and there's one step as well prior to everything is, you all work for agencies. If you feel there is a funding need, that's the first step, to go to your head of department, whoever, and ask for a building block, because there were very few building blocks this year from the health department. And I know there's a need out there in a lot of programs for more funding. So the very first step is getting that building block through your state agency. And now it's Health and Human Services combined. And then that goes to the governor's office. And then from there, if it gets in the governor's budget, then it goes to social services appropriations. So, there's a front end and a back end. And I think the front end is as important as the back end as well. Because if it doesn't get in there, it's not there. So.
And I think that some of the changes that have happened since Governor Cox was elected, with the merging of those organizations at that top state level, the people who have filled some of those spots are we have some great opportunities because of some of these changes. So I think there are some discouraging things that have happened recently with our legislature, and there are some opportunities that have happened with some of the changes under Governor Cox as well that we should take advantage of for sure. So thank you for bringing up the building blocks, Janet.
As I'm retired and not with a state, I can say this. So my representative, Suzanne Harrison, was redistricted out of her district. And she's now running for Salt Lake County Council at large. Suzanne is awesome. She sponsored the nursing bill to add nurses to all the districts. And so if you're in Salt Lake County, I encourage you to support Suzanne.
And I will just also throw this out that I think sometimes the information that we get on something that's happening, something that's moving through as a bill during the regular session or through one of these interim committees, it can be confusing. The way it's worded or the way it's being, we're getting the information through whatever means, it can be unclear why it's good or bad or how it might affect the people that we work with or care about. And the HOPE scholarship was a little bit like that. Some of the way it was wording made it sound like, well, why would I oppose this? This sounds fine. This sounds like it'd be good. It's important to dig just a little bit. And so if you have an organization or individual that you trust, I would encourage you to ask those questions or try and, look to that source for clarification. And so the Utah Health Policy Project is I get their emails and I feel really confident about the kinds of information I receive from them where they're able to sort of look carefully at some of these things. And I know, for instance, Janet and Gina would be happy to help us if we're confused. They'd be delighted to help explain some things. Eric, did you want to share something?
I was just going to say along those lines, I know that even I will pull up language from a House or Senate bill, and you read and read and read and read and read. And if you can get past the definitions, you've knocked it out of the park. So sometimes finding exactly what you're looking for and really what the intent is can be difficult, and really understanding the gist of the bill is sometimes problematic. I do say though, go to a reliable source like some of our colleagues, and as Mindy has mentioned, because we live in an age of conjecture and everyone has a view and hypothesis and all of the rest of it. And I say, go to a reliable source. Everybody, depending on what side of the fence they're on, has some sort of an opinion on why a bill is good, bad, or otherwise, but be informed and go with a trusted source, not just a Facebook post or because Uncle Bob says it's this way. Go to someone that you can trust, an organization that really knows what they're talking about. And we have some terrific advocacy groups out there. Again, our friends who are on this call, Disability Law Center, some of these folks who really do a fantastic job tracking these bills for the populations that we all serve.
And we'll make sure and list all of those organizations that partner with LCPD and their websites and so forth in the summary. And again, I just encourage you to get on their mailing lists and join where you feel like you can. Even if it's just getting information, the more informed we are, the better. Excellent. All right, I'm going to go back to my regular slides. Does anybody have any questions for Janet and Gina? We appreciate so much what you guys have done. Your time is so, let's see, talking and doing, and that's not what I want. Let's try that again. We just really appreciate the time that you spend. This stuff is complicated. So, and Janet's just put her email in again. And so that's terrific if you want to go ahead and get in touch directly with Janet. I guess I just need to close that one down. There we go. All right. Okay. So I just want to remind you again about that listserv that we have and you're all a part of by virtue of being on this call. You're on our listserv, and you're welcome to email directly to that at any point in time during the month, and it'll go out to everyone, or you can just send something to me and I will send it to the listserv. And that's a way for you to ask for help from your colleagues in this meeting if you need it between meetings, and share resources as well. Our next meeting is April 20th. And again, we'll have some information from some URLN trainees about enhancing referrals, and we're looking forward to that. And I think that we're good. I think we're going to wrap up a little bit early and give you back a couple of minutes. I wore my green today because St. Patrick's Day is tomorrow. I hope everyone has a good one. And I hope that you all adjust to the daylight savings change faster than I am. It's great to see all of you, and enjoy the rest of your March month, and we'll look forward to seeing you in April. Thanks, Janet and Gina. You guys know you're two of my favorite people. Really appreciate your time.